The Free Healthcare Initiative, introduced by the government of Sierra Leone in 2010, geared towards providing free healthcare for pregnant women, lactating mothers, and children under 5. The Demographic Health Survey in 2013 reveals that there has been a slight decrease in teenage pregnancy among girls aged 15 to 19. To advance women's health and support the Free Healthcare Initiative, the government of Sierra Leone has integrated family planning into the free healthcare.
In 2010, His Excellency the President launched Karma in Sierra Leone. A month after that, he launched the Free Healthcare Initiative for lactating mothers, children under 5, and pregnant women, so free services for them. And that included family planning. So we had a great opportunity at that time when pregnant women came into the facilities to give birth. Part of what they had was education and sensitization on family planning, on what they needed to do for themselves and their families as it relates to family planning.
Family planning as an intervention has been found to be very, very good in terms of promoting the health of women and why not even the health of children in any given community. So as a result, it has been given the maximum priority. And we know that when family planning is introduced or when the uptake of family planning increases, it tends to bring about a reduction in maternal mortality and as an extension also child mortality.
Promoting family planning in Sierra Leone, where tradition and culture misunderstands its importance, is not easy. The Demographic Health Survey conducted in 2013 reveals that 17% of women in Sierra Leone use contraceptive method of any kind and 16% use modern method. The UNFPA is supporting the Population Media Center to promote the importance of family planning through the Saliwansai radio drama serial.
I mean, we know we have a lot of negative people's negative perceptions about family planning. You have a lot of men who do not believe in using contraceptives, allowing their wives to access health centers, go to hospitals. They have a lot of people think that even children are given by God. It's by chance, not by choice.
Yes, Abu.
You and I not. Are you still in web? Because I was in it also. And they forget.
Salwansa is just like the stream going out. You go there, go there, go there. I have to move around. I go to Kamadoki. As I travel. When there is problem, in the community, as a community health worker, I do a lot to talk to people, to show them what they should do, the advantages and the disadvantages of going to the hospital or going to like Maristops, or when you go to the hospital, they give you medicines like contraceptive, you have Captain Ban, you have coil that will take to prevent you.
Restless Development, through their peer volunteer educators, educate teenage mothers about family planning.
We normally go out there, talk to them, how they should encourage them to send them back to school.
Well, they don't teach me how, like, I don't end up picking with or worker, how myself for prevent myself from pregnancy. And then they teach me back for make I go meet my company out for advice them.
The UNFPA is working with the government of Sierra Leone to step up family planning intake and uptake.
In Sierra Leone, UNFPA is working with the government to strengthen family planning services by ensuring that midwives are trained and are available to provide the service, ensuring that the supplies and the contraceptives are available, and also investing in other infrastructure needs, what we call health system strengthening, to make sure that the service delivery is of quality and happens effectively.
Okay, I've been trained since 2011, and one of a workshop sponsored by UNFPA as a trainer and as a service provider and also a trainer for implants.
I get this implant from a radio station, this program what they call Sally One Side.
The Ministry of Health and Sanitation, with support from the UNFPA, engaged parliamentarians, training them to advocate for increased resources for family planning.
I am going to be a voice for the kind of like, if I will call it, if you don't mind, I will call it the voiceless women out there in Parliament, in terms of ensuring that laws are legislated, that we legislate laws that are going to put these situations in the limelight, and that the laws are not just legislated, but that they are implemented.
What successes have been made?
As part of the plans to make family planning more acceptable and the interventions to reach out more at people, especially out in the periphery, as a ministry and as a directorate, we've decided to introduce a performance-based financing scheme or family planning into the performance-based financing scheme. What this actually translates to is that each time there is uptake of the services by members of the community out there, the staff of any peripheral health unit get some amount of money paid to them at the end of that quarter based on the number of on the uptake of the services itself. And with this, we have been seeing an increased uptake because it gives motivation to the staff to go out there and get those people who want to take up family planning but haven't got access to family planning to be able to have easy access to family planning.
I think the best success so far is the fact that we have ensured that the contraceptives are available in all facilities. We have trained health workers to make sure that they provide quality services.
How determined is the government to further promote family planning intake and uptake?
In 2013, His Excellency the President launched the National Strategy for the Reduction of Teenage Pregnancy. It is a multi-sector strategy, and that includes a whole lot that we're doing for young girls as it relates to family planning, equally so, where we have 1 in 3 girls being pregnant at an early age. We believe that a lot needs to be done on educating girls on how they understand their bodies, and part of it, the education process and the sensitization process, is about family planning, to teach them that.
As a government, we have to take full responsibility for the future of our teenage girls. We believe that we have already taken the lead in terms of coordinating the approach. We want to thank the donor community for the responsiveness they have demonstrated in this great effort. And we believe that the leadership we have shown is enough demonstration of our commitment, and we will continue to engage the donors, will continue to engage the other layers of people within the communities, the other levels of governance in the country, to ensure that everybody is fully involved. The future of the country depends on our capacity to address this problem. Women are the future of the country. Women, especially the young girls, constitute a majority of our population, and therefore we have no choice but to ensure that we address this issue so that we prepare a brighter future for them and hope for the country.
As the government partners with UNFPA to promote family planning, there are challenges ahead.
I think the challenge is usually the issue of quality services. And of course, we're also working at demand creation. Demand creation means you work with communities to ensure that the families, the women, know the benefits of family planning and therefore go out and get it. So those are areas where we are working very hard to ensure that in the coming years we get more women knowing the value of family planning and therefore start using it to improve their lives.
A lot needs to be done, as I say. We need to get a lot of the commodities out here, and then we need to see how we can step up, especially the outreach of our staff. Our staff need not sit in one place and wait for these women to come.
As the world's population turns 7 billion, Sierra Leone is working her way up the family planning ladder.
For us, our teenage pregnancy strategy is a multi-sector strategy, and part of the health interventions is about family planning and education about reproductive health. So this is key for us, and this is important. And all partners and ministries, departments and agencies that are part of that national strategy to implement the activities in that national strategy for us to reach the goals that we have outlined are part of the process, and they have bought into it, they have signed up to it, they are committed to it, and this is what we'll be doing moving forward.